60% of veterans are affected by preventable diseases and other preventable health conditions. Cancer, heart disease, infections, obesity, substance abuse, mental health, and other conditions. Research shows that veterans can reduce the risk of disease and maintain good health through preventive care, including the early detection and treatment of diseases and conditions. Clinical preventive services, such as disease screening and immunizations, are key to reducing premature death and disability and improving the health of our nation's veterans. Yet, how can VA ensure that both patients and providers have the right preventive information and tools? The VA National Center for Health Promotion and Disease Prevention, or NCP, provides recommendations on dozens of clinical preventive services that can prevent or reduce the risk for heart disease, cancer, infectious diseases, and other conditions that impact the health of veterans. NCP is VA's central resource for evidence-based clinical preventive services, guidance, and resources. NCP CPS guidance statements provide clinicians with recommendations based on the best available evidence on such topics as disease-specific screening, counseling, and preventive medications. NCP maintains and regularly updates more than 30 guidance documents as sources for making clinical decisions about preventive services. The guidance statements consider the scientific evidence on each topic, as well as the recommendations from the U.S. Preventive Services Task Force (USPSTF), American Cancer Society, and the Advisory Committee on Immunization Practices (ACIP). The evidence and recommendations are carefully considered by VA's Preventive Medicine Field Advisory Committee in the development of VA's guidance on preventive services. NCP ensures that VA clinicians have access to the critical information they need to deliver the best healthcare possible, including clinical preventive service guidance statements, clinician fact sheets to guide practice of prevention methods, national clinical reminders such as reminders for breast cancer screening, hepatitis C screening and pneumococcal immunizations, review of information for safety alerts, monthly updates on prevention.va.gov, and national health promotion and disease prevention calls to address the latest evidence-based information and resources. NCP also delivers clinical preventive services (CPS) aligned information to veterans through support tools such as My Healthy Vet and the NCP website www.prevention.va.gov. Healthy living messages including Get Immunizations and Screenings and Be Involved in Your Healthcare provide veterans with the tips and tools to take charge of their health and well-being. What are the benefits? Prevention works. VA prevention guidance and tools are helping clinicians deliver evidence-based preventive care to veterans. Due in part to NCP's clinical preventive service guidance, VHA is the recipient of the National Colorectal Cancer Roundtable's 80% by 2018 National Achievement Award. To learn more about NCP, clinical preventive services, and available resources, go to vaw.prevention.va.gov/CPS.